Hi everyone, I'm Sherry Weingart, one of your instructors in HPA400, and we've had a good time this week, haven't we, exploring all these dimensions of ethics and what they mean to us as public health professionals. It's been fun to read how you've grappled with various issues and the thoughtfulness that you've put into them, and those are really the two hallmarks of ethics. They require a certain thoughtfulness to bring our best kind of an alertness and attention to the issues, not to just do it by rote and kind of refer to something in a canned way. And also that ethics is a struggle. The image I like to have when somebody says, well, we're wrestling with an ethical issue. My image is there's two people on a mat and they're holding each other and they're grunting and they're really tied together in earnest force. And that's really what happens when we have ethics discussions. Ethics isn't a thing. It's not a set of principles, even though we gave you, and you argued well for your various thoughts on the various principles. But if those were embroidered into a sampler and put on the wall, they'd not be very effective. The point of ethics and having an ethical sense and an ethical consciousness is being able to have the conversations. And these are the conversations that we have with ourselves, what we call our still small voice, whether that's a little person on our shoulder or if it resides deep within us. And it's also conversations, obviously, that we have to have with each other. And it's not one and done. Ethical conflicts, ethical dilemmas. A dilemma is a little less severe than a conflict, and it's not quite as polarizing. But we all will face ethical dilemmas, always. It's inevitable. And you have spent some time initially thinking about this now, and we hope some of the things that we do later in the semester will also help you put some of these ideas into use. I want to get a little bit specific, and perhaps you remember that Professor Schwartzman indicated that he and I have done a lot of presentations on ethics and public health and are writing a book right now. One of the things that we think it's important to understand is that there are four basic frameworks for thinking about public health ethics. The first one, and these are not in order of importance or anything else, but the first one is research ethics. Are the people that we're working with protected? You know, human subject protections, IRBs, research ethics about what is allowed and not allowed in terms of our conduct and community. There's everything from etiquette issues to real ways that one can ruin a public health situation by being culturally incompetent, for example. Some of those have to do with research ethics, and they're not just bench issues. They live for us in the community as well. So research ethics is one thing. The other kind of ethics that we cover are professional ethics, and that's distinct from the research ethics. Professional ethics have to do with codes of professional behavior. And these, several of you wrote that, well, we have the public health principles that the Public Health Leadership Society created through a lot of discussion over time. Well, principles are great, and we spent the first part of our lesson this week really going back and forth on these, which is terrific. But principles have to live, and they're not just a list that we of ought tos or should do or aspirational statements. It's fine that we aspire to do X, Y, and Z, but the way ethics lives within an organization and within us is providing structures and incentives and disincentives and support for through and through kind of living of organizational ethics. So Professor Schwartzman and I have presented on these issues for a few years now, and you may not have realized in the library under course documents that under week 3, it appears in very small type until you open it up, but there are several presentations that we'd like to direct your attention to. One of them was done, actually has a lot to do with Duncan, the reading for the third part of this week, where he reviewed the mission statements of state health departments. Well, Professor Schwartzman and I got the idea to do something similar, and we examined the mission statements of local health departments in Illinois, and then we had dialogue with some of the local health department directors about that. And how often do you think about ethics? What do you do if you have an ethical dilemma? Who do you think you have that capacity in-house? Do you feel you have to go outside, etc.? So we have one of our presentations, and I think it's from '06 or so, that we did on that. Then we have another, or maybe that's '08. Then we have another presentation that we did in June of 2011, where we talked about ethics, organizational ethics, in the context of prevention and prophylaxis, and that if one does not build up the organizational ethical muscle beforehand, then you don't have access to that power when a crunch comes, when a crisis comes. So please check out that PowerPoint, and we're happy to discuss the particular content of it if you like. The third one that I'd like to direct your attention to that has to do with organizational ethics is something we delivered at APHA in November of 2011. And that was an attempt to say why organizational ethics are a worthy endeavor to spend a good amount of time on, and what the payback is for doing that. So I really hope you'll take a look at those, and then we can continue the dialogue over the next few weeks with some of that in mind. So we've covered professional ethics and research ethics, and the big kind of sweeping sort of ethical soup that we all live in, our social ethics. What is right and wrong, and how do we know, and what do we do when we observe right and wrong in the world that we have promised to dive headlong into in our pursuit of improving the public's health. We'll talk a little bit about that another time, but thanks very much for getting so involved in the assignment this week, and more to come.